Well, it's Greg Downing here, and today I'm going to go over exactly what Medicare Part A covers and what it does not cover. It is your hospital care insurance when you're in the hospital. It also provides skilled nursing, home health care services, and it is normally free. There's no cost to this as long as you've got 40 credit hours, which is basically about 10 years of work, or your spouse has done that. Now, again, you do have responsibilities such as a deductible. Part A has a $1,316 deductible in 2017. Let's look a little more detail at exactly what it covers and what your responsibility is. All right, so let's say you do end up having to go into the hospital. Now, as long as you're in there less than 60 days, you're going to be in pretty good shape. You just have to worry about meeting your deductible. But in the event, the unfortunate event that you're past 60 days, you're going to have to come up with a $329 copayment per day you're in there. And God forbid if you go past that 91 days through 150, you got to pay $658 per day is your cost. And in the real unfortunate event, you're after 150 days, you have to pick up 100% of that cost for each day after 150. And this is just a one-time benefit you get here. This never in your lifetime, you never get that again. All right, so you can see there could be some exposure there if something bad happens, and psychiatric hospitalization works exactly the same way. All right, so let's move over to some of the other coverages that it provides, and that is skilled nursing. Now, as long as you're in there for less than 20 days, it's covered at 100%. You have no cost. But if you go over 21 days, you got a $161 copayment per day, and then if it lasts more than 100 days, you're going to have to pick up 100% of the cost of those additional days. All right, now home health care services. Basically, you're going to pay 20% of the approved Medicare approved amount for any medical equipment that you will need for home health care. Now, hospice care has some copays. They're not that expensive. But you are responsible for some of these costs. Now, here's an interesting thing, and a lot of people know that the first 3 pints of blood each year that's given to you, you have to pay 100% of the cost. I was curious exactly how much does a pint of blood cost, and I'm not exact on this, but lots of research. I couldn't find the exact answer, but it's anywhere from about $300 to $500 per pint that you would be responsible for. So that's the way Part A works, and you can see why it's important to have a supplement to cover those extra costs in the event that that happens. All right, again, my job is to help you keep your money. And I think a Medicare supplement is the best way to do that. Give me a call if you have any questions, and you have a great day.